Our week 2 health focus is going to be sleep. First off, why is sleep important? The first thing that comes to mind most of us will think about is just feeling alert. After a bad night's sleep, you wake up, you're really groggy, hard to get through the day, you're kind of just looking forward to getting to bed all day. But there's a lot more than that. So, some of the other things, especially what I'm going to focus on, is related to fitness, all the things that we're doing with the walking and exercising and trying to maintain weight or lose weight. So, what that is important from, first off, is recovery. So sleep helps with our neural and our muscular recovery. What does that mean? So after you do a hard workout, the next day you might be sore. Even if you're not sore, what happens is, your body needs to take some time to rest. That's why I space out your weightlifting days, is because you need to build back up the energy systems, and also just the musculature itself is actually rebuilding. So you're having muscle synthesis, and that actually happens during your sleep. Along with that neural and muscular recovery, it's also going to reduce your inflammation. So if you're like me, I get sore very easily. Almost after every workout, I'm sore. And I also have a lot of joint aches and pains that I deal with. And so sleep actually helps to lower the inflammation from those. You'll notice if you go through a week or two period of not getting very much sleep, you probably have a little bit more joint soreness and joint pain. And if you get one good night's sleep, a lot of that clears up and you feel a lot better. So that's another reason sleep is so important. Another one, which is especially important, has been the focus the last year and a half, is our immune function. So I know for myself, anytime I travel, and pretty much always when I travel, I end up not getting very much sleep, and almost every time I get sick. But as soon as I come home, get a full night's rest, I'm pretty much better the next day. So immune function is a big thing, muscular recovery, neural recovery, and lowering inflammation. Another reason sleep is important for us, especially, is for your weight maintenance and weight loss. So when you go for a few nights of not getting very good sleep, or if you're a chronic bad sleeper, you actually have higher levels of cortisol. You may have heard of this. Cortisol is kind of a stress hormone. It's very important. It plays a really important role in our bodies, but too much of it causes a lot of problems, specifically for us, fat storage and muscle loss. So it also is so basically what we're exact opposite of what we all want to do. We all want to gain a little bit of muscle, lose a little bit of fat. Lack of sleep also increases your insulin resistance, which that basically means that your body cannot process carbohydrates as well. So that's you've probably heard of insulin sensitivity and things like that in relation to diabetes, but we all have insulin, and it's all important for us to regulate that properly. When you don't get good sleep, it's not being regulated properly. Along with that, lack of sleep lowers our leptin levels. So leptin is just a hormone that is produced in our body that tells us when we need to eat. It's basically our appetite. And so when we don't get a lot of sleep, leptin is not produced, and it's basically telling us that we are hungry and need to eat more. I know for myself, I always can tell if I have a really bad night's sleep, the next day I almost always am having bad cravings. I want sugary foods, I want fatty foods, I want to go get fast food. So there's another reason why we need that sleep. Some of you might be watching and thinking, I get plenty of sleep, I sleep a lot, I don't really have any trouble with sleep. And I hope that's the case. Most of us go through periods where we do get good sleep, where we get bad sleep. But some signs that you might not even be aware of, especially if you are a chronic bad sleeper and you've just gotten used to those feelings, some things to look out for to know that you have bad sleep is obviously chronic fatigue. Like if you're tired all of the time, and there, of course, it can be many things, but lack of sleep is a big cue for that. If you wake up feeling groggy, that's another indication of bad sleep. Pretty clearly, if you wake up, you should be waking up refreshed, not groggy. Another sign would be exercise performance. That can be just a way day to day you can tell if you're getting good sleep or not. Because even if let's say you get 8 hours of sleep, and that's your metric for measuring good sleep, that's not necessarily always the case that you're having, the proper amounts of deep sleep. We can talk about REM sleep and non-REM sleep. Those things are still factored in. Even if you get 8 hours, you're not always getting the proper amounts of those types of sleep. So you can pay attention to your exercise performance. If you see huge decreases, it's a pretty good indication that your recovery, which is also your sleep, is not. Needing to drink coffee all day long is another sign that you're not getting enough sleep. If the only way you have energy all day is by drinking coffee, there's a pretty good sign that you're not getting enough sleep. And it's also affecting your sleep by having that caffeine all day long. So it's kind of an endless loop that you're putting yourself in. One last sign that you might not be getting enough sleep or not getting good sleep, good quality sleep, is that you need to take something at night to help you sleep. So even if you're somebody that's taking melatonin nightly, or if you're drinking, a glass of wine or whatever you have to help you fall asleep, those are also signs that you're not getting adequate sleep. Next, let's talk about some tips to improve your sleep quality, help you fall asleep faster, and just overall sleep better. Some of these things are definitely not fun, or they're not ideal. It probably is going to screw up your nightly habits, but in the long run, these are going to benefit you. The first thing to try if you're not getting good sleep is to back off on your caffeine consumption, particularly just trying to quit drinking caffeine earlier in the day. You want to stop drinking caffeine 8 to 10 hours before you go to sleep. So if you are somebody that goes to bed at 11, that means you need to stop drinking at the latest by 3, but preferably by 1. The reason for that is because the caffeine stays in your system. Just like any other chemical or drug, it has a half-life, and it's lasting into that sleep. So if you drink caffeine at 6 and you're like, well, I fall asleep fine, it's still affecting the quality of your sleep, because it's basically what it's doing is blocking some receptors in our brain and telling us that we don't really need that much sleep. Another thing that you can do with caffeine intake, coffee, tea, all those things, is wait a little bit before you drink it during the day. So you want to really wait about 1 to 2 hours if you can before having that first cup of coffee. When you have coffee to wake yourself up right away in the morning, you're really throwing your whole circadian rhythm out of whack, because you're actually supposed to be producing chemicals in your body to make you more alert first thing, but you're basically telling your body and brain that you don't need those things because the caffeine is in your system. So better to wait a little bit. I know that's horrible. I like to have my coffee first thing in the morning, but it's definitely better in the long run to wait. That's the first go-to. I always ask people about their caffeine consumption. Next one is limiting your screen time at night. That's another one that nobody likes to do, myself included. But if you can, you really want to limit screen time an hour before bed. So if you go to bed at 11, you should try to shut off phones, TVs, everything by about 10. So, maybe that means you need to read a book, do whatever you're going to do some stretching or something like that, and avoid the light exposure 1 hour before bed. Just like the caffeine, light kind of does similar things in your body, basically telling yourself that it's daytime and you can stay awake. And then that's going to throw off, that time that it's supposed to take, a couple hours after the sun goes down. Then our body is slowly drifting off into that sleep time. We're basically telling it that the sun is not down yet and that we can stay up longer. So really try to limit especially phone time, because we have it so close to our face. It really affects us. And TV as well, and even bright lights in your house. If you can dim your lights or light some candles, things like that are going to go a long way. Another thing with the light exposure is having your room really dark. So I know when I changed that really made a big difference for me in my sleep. I get blackout curtains. I try to turn off every light that I can, put tape over little lights that are shining in the light in my room. And then I also have a sleep mask that I sometimes wear to even make it darker. This is the sleep mask that I wear. It's got like these things. It's pretty comfortable. I really can't see anything. It's completely dark when I wear it. Sometimes it gets uncomfortable when I'm sleeping, so I'll throw it off at night. But it does help me get to sleep, at least if I'm having trouble, or if I'm on a plane or somewhere that I can't control the light. So those are 2 fairly easy ones that you can try out, and those will probably make a really big difference. The next thing that you can do, depending on your schedule, it might be a little bit more difficult, but it can also go a long way in helping to reset your circadian rhythm. So if you're somebody that has trouble falling asleep at night, this is something that you can try. Is when you first wake up, let's say, if you are somebody that wakes up fairly early, 6, 7, around the time that the sun gets up, if you can get outside and maybe go for a walk, or just be outside for 10 minutes, 10 to 30 minutes, that's going to kind of help tell your body, okay, time to wake up. And then once the sun goes down later at night, your body's going to remember that, okay, that was the time the sun came up. Now the sun's going down and it's time to go to sleep. So it's important to know, like, even if you're in your house and you have a really bright room with lots of windows, if you're behind glass and the sun's shining through the glass, it actually takes longer because a lot of that light is blocked by the glass. Even if you think you have really clear windows, it's just the way it is. So that kind of doubles your time. So if you only need 10 minutes because you live somewhere really bright and you're outside, it's actually going to take like 20 to 45 minutes if you're in a room. If you can, just get outside. If you live somewhere really bright, it only takes about 5 to 10 minutes, and that will help reset that rhythm. If you're somewhere a little bit cloudy, especially in the winter, it's probably going to take you a little bit longer, you're going to need about 30 minutes. It's also important, if you can, don't wear sunglasses, don't wear a hat, and have as much skin exposed as you can. For anybody that works, third shift or works nights, or they just have a weird schedule where they're up before the sun comes up, you can actually just it takes a lot longer, but you can make your house really bright, and that will help. So turn on all the lights in your house. That's also going to help. It's not quite as good as the sunlight, but that's what you can do, if you're in that situation and you need to make some adjustments for yourself. The last tip I'll give you, this is another pretty easy one that you can try right away, is just breathing. So this is another tip that I've used. I've used all of these things for myself, and they've all worked. This is a big one for me as well. So a lot of times I have trouble falling asleep at night, and it's basically meditation is what I do to help myself fall asleep. So I used to use an app called Headspace, and they have a sleeping meditation. You don't necessarily have to do that. It's more important just to be focusing on the breath. So if you focus on the breath, it just gives you something to clear your head. Because, we always have thoughts racing through our mind. So if you can focus on the breath, that kind of takes you out of it, brings you into this present moment, and you can focus on that. So you don't even have to do any special breathing or anything. Just count your breath. Just as you go to sleep, inhale through the nose, exhale through the mouth. That's inhales 1, 2, 3, 4, all the way up to 10, and then you just reset. And you probably fall asleep fast just doing that. But if you don't fall asleep from that, another little trick that you can do that I've had a lot of success with is you just take yourself through a little rewind of your day. So do just a few repetitions of the breathing, nice deep breaths, and then take 20 to 30 seconds to just play back your day through your head. So start from the time you wake up. Let's say you wake up, use the bathroom, you take a shower, you go for a walk, exercise, you go through all of that in your head and just play it, just 20 to 30 seconds. And that actually helps people to fall asleep too. The last thing that you can do, this is especially good if you wake up in the middle of the night, is it's called a physiological sigh. So all that is just a couple breaths followed by a deep exhale. And that just kind of tells your body, okay, we can relax, time to just go back to sleep. It also helps with anxiety or stress during the day as well. So all that is you take one deep breath and then you follow it up with another short inhale. So, and then exhale. So those first two inhales are through the nose, and then exhale through the mouth if you can. So long inhale, short inhale, and then long exhale. So just a quick recap of those tips to help you sleep. First one is limit your caffeine consumption. Try to stop 10 hours before you go to bed and wait 1 to 2 hours after you wake up to have it. Next one is limit light exposure an hour before bed. Try to turn off your phone. Especially if you wake up in the middle of the night, don't get onto your phone. Try to avoid turning on lights, avoid getting on your phone. Just try to fall back asleep naturally. And then first thing in the morning, try to get outside, get some sun exposure, go for a short 10 to 20 minute walk. And that last one was focus on your breath when you go to sleep. So you're basically doing a little meditation, rewind your day for 20 seconds, do that physiological sigh. I hope those things help.